Good morning, everybody. I hope you are well in these very, very strange times. My name is Kath Williams. I am the Programme Director for the Foundation to Health and Veterinary Studies. And as I've just put up in the chat, this is a unique programme which gives a pathway into 10 different careers in health, and I've listed them there. Everything from medicine right through to veterinary science. It's actually designed for people who maybe took a different pathway in their studies and have now decided that they really want to switch into a health-related career. So I'll take you through the programme using this PowerPoint here. And hopefully by the end of it, you will have a good overview of what the programme's about. Please put any questions that you like up in the chat, and at the end, I will go through the questions that you've put up and hopefully start to answer some of them for you. Okay. So what is the ethos of this programme? Well, the programme really is targeted at mature students with appropriate workplace experience. Now, I've highlighted mature students because I need to qualify that, because it's nothing to do with age. It's nothing to do with being 21 or over. It's actually to do with how much life experience you have and having been out in the workforce for some time. So, for example, we've had students who are 19 going on to 20 who left school at 16 with some GCSEs or equivalent qualifications and went out into the workforce. The young lad I'm thinking about particularly went to be a manager at JD Sports and suddenly decided at 19 that they really, really wanted to be a physiotherapist. But it's really difficult to get back from that position. And if you've taken the wrong route, taken the wrong qualifications, trying to get A-levels again and signing up for those and getting back into studies is not easy. This programme is designed to do that. This programme gives you a doorway, as it said in the title, kicking down the doors so you can get back into higher education at the university. So we're looking for people who want to switch, who have decided to do something a little bit different from the path that they started out on. Because of that, the programme definitely meets the widening participation ethos of the University of Liverpool. All universities have this widening participation agenda, but this programme really does help that agenda and feeds into it very, very well. So, as I said in the chat, what we do with the programme is facilitate entry into all of these routes. And if you look at the screen now, you can see professions allied to health. That encompasses all the ones that are listed in the chat. If you're not quite sure, you can go and have a look. So obviously diagnostic radiography, radiotherapy, orthoptics, and so on. And of course, nursing. And the programme is designed to bring everybody up to the correct level so that they can compete really with our direct entry A-level students in year one in class and not feel as though they're floundering, and they can converse with those A-level students on the same level and understanding. So the programme really is quite intense. It's 1 year long, it's 12 months, and in that time you'll, as I'll show you in a little bit, you study topics that are equivalent to the A-level topics that we would require from our direct entry students with A-levels. So it is intense, it's hard work, it's full-time, but it's really, really worth it. And hopefully you'll agree with me by the time we get to the end of this presentation. Now, even though it's a University of Liverpool programme and it's our modules and students that are accepted onto the programme are registered at the university with all the benefits that go with that, we have 2 partner colleges in the region who deliver the modules for us, because obviously, you know, we're lecturers in our own specific professions. I'm actually dual qualified. I'm a diagnostic radiographer and a radiotherapist. And a lot of the other module leaders at the university are from the range of professions that I've already outlined. So we've got an orthoptist, we've got a doctor, we've got a vet, we've got a dentist. But you know what? It's been a long, long time since we taught or even studied A-level. So the best thing that we found we could do was to contract the teaching out to these 2 FE colleges, that's further education colleges, who are the experts in A-level studies. So the first college is Carmel College at St Helens. If you're not from the north of England, you probably won't know where that is, but it's just slightly north of Liverpool and Manchester. And I'm sure that this PowerPoint will be available to you after this presentation. And there's a link there to Carmel College that you can go and have a look at to see what it looks like. It's a brand new college, really, in that it's just been refurbished. It's got an excellent reputation, as you can see here. And at this college, we send not all the students on all the routes, but some of the students on some of the routes. So the medicine students study at Carmel, dentistry and dental therapy, and veterinary studies all study at Carmel College. Now we've done that, we've split the routes into the 2 colleges simply because of resources, so that we can make sure that all our students get the best learning experience at the different colleges. Okay. Oh, there's dental therapy. I knew it was on there somewhere. Okay, so our second college is called Birkenhead Sixth Form College on the Wirral. If those of you are not aware of the geography, there's a river that runs alongside Liverpool called the River Mersey, and the Wirral is a peninsula just on the other side of the River Mersey. If you're familiar with the song Ferry Across the Mersey, that's where it came from. It's very easy to get to. There are 2 tunnels going under the Mersey to get you to the Birkenhead Sixth Form College, and there's trains and there's buses as well. So the links to both our colleges are very, very good, and you can reach both of them. If you're in Liverpool, you can reach them very easily within about 20 minutes. So which professions do we send to Birkenhead Sixth Form College? Well, it's all the allied health. So we've got physiotherapy, diagnostic radiography, radiotherapy, occupational therapy, orthoptics, and nursing. And again, if you have access to this PowerPoint after this presentation, there's a link up here which will take you to Birkenhead Sixth Form College, so you can go and have a look and see what they have to offer. And there's a picture of the college. Again, a very, very modern college. Again, recently refurbished with lots of resources, especially IT resources, which is very useful in this time. Hopefully, if you're interested in these routes, you've now got an idea of the 2 different colleges that we use for our teaching. So what will you learn? So remember I said before that this program is designed to make sure that you have the same level of skills and knowledge as our direct entry A-level students. And the topics that you'll see on here shouldn't be a surprise to you, because they do link to our health-related degrees at the University of Liverpool. So obviously, as you can see here, HEAL 001, all our modules have like a code. So if I talk in code, I apologise. We're so used to using that. But the topic is biology for health studies. And you can see our dentistry and medicine students and our veterinary science students study HEAL 001. Then there's some chemistry for both of those. The vets do a little bit of maths. The dentistry and medicine do health and social care. So they've got an idea of what's happening in our society today with our health and our socio-economic climate, which you can imagine at the moment is really, really important. HEAL 005 is a portfolio. If you're interested in health programs, you'll know that portfolios and reflective practice are extremely important. So we start this off right at the start of the program. So you learn about portfolios on the foundation program, and that'll carry you through to your degree programs. And there's the same here. HEAL 012 is the portfolio for the vets. A second biology and a second chemistry. So these are the topics that we want our A-level students to come in with in all of these routes at the University of Liverpool. And so we mirror that on the foundation program so that you can succeed. And here we go, Birkenhead Sixth Form College. So these are the modules for all the allied health. Remember, the allied health is all of those individual programs I've just mentioned, plus nursing. And they're very similar. They also study the biology for health studies. They do a maths module. So, many of our students that come through really struggle with some of the maths and the science, and maybe that's why they didn't do very well at school, because they couldn't get their heads around those topics. What I would say to you is that don't panic about that if you're interested in these routes, because the teaching at the colleges is exemplary, and they really do help students to get their heads around maths, and they teach in a very unique way. So the support, the feedback from our students that have gone through the program say the support at the two colleges is absolutely fantastic in the maths and the biology particularly. They also learn a little bit about applied psychology. We in health really need to understand our patients much, much more, and it's about holistic care. So it's not just about delivering whatever therapies or treatment that we're trained for. We also need to understand the patient's point of view and their families, and that module helps you do that. Foundations of Professional Studies, again, this is a portfolio with lots of reflective reports in there to help you understand why reflective practice is important. Second biology, a second maths module, and then just like the dentists and the medics, health and social care for health sciences in the broader sense of what's going on in our society today with regard to health. Okay, so they're the modules which hopefully you'll see if you've researched any direct entry routes into health programs. You'll know that these are the kind of A-level topics that we're asking for those routes, so this is no different. So how do you pass? Well, for each of the modules, because they're University of Liverpool modules, you can pass each module at 40%. All right. However, you have to pass all of the modules. You can't carry any failed modules over. So in the 12 months that you're studying with us, whatever module has been allocated to you in the pathway, you have to complete all of them. However, this is something else that you really need to understand, that if we allowed you to progress to year one with just 40%, that's only the equivalent of A-level at maybe a C or a D. Now, the University of Liverpool is a red brick research intensive university, and so our offers for A-level students is quite high. So, certainly for medicine and dentistry, it's 3 A's, and for the rest, 3 B's or an A and 2 B's. So the foundation program needs to reflect that in some way. Otherwise, we'd be setting our students up to fail. So you can pass all modules at 40%. However, your year average mark has to be higher than the module mark. So when we add all your modules marks together, the average must kind of mirror the standard A-level entry marks. So as you can see, for medicine, dentistry and vet science, we expect you to have a year average of 70% or above to be able to progress to year one. And for the others, allied health, dental therapy, and nursing, your year average has to be 60% or above to be able to progress to year 1. So these percentages reflect as I've said, the A-level offers that we make on the direct entry routes. Now, if you don't meet that, this is always a question that I get asked at open days. Well, I've worked for 12 months. I've passed all the modules, but I can't progress. So what happens? Well, we have in place an exit award, which is called the Foundation Award. So you don't leave with nothing. So I'll just go back to that. What I've noticed recently is our Foundation Award at the University of Liverpool is considered to be an extremely good award, and we have had students in the past who have achieved around about, say, 55%, who have then used the Foundation Award to apply through UCAS in clearing for their professional degree at a different university. So you can't apply through clearing back at University of Liverpool, but you can certainly apply through clearing to other universities. So it's not wasted if you don't make the year average. You can progress at another university. Usually there are places available. Okay. So what will it cost? I think this is really important, especially for mature students who are thinking about maybe leaving their current job, which is a big decision to make. So you have to understand what the finances are involved. And as you can see there, the current fee for our foundation is £5,140. It's still under review. Now, you may be looking at other courses such as access courses, which may be a little bit cheaper. What I would say to you is that the unique thing about our program is that if it's a 1+ route, so if you are accepted onto the foundation course and you are successful in getting your year average, you automatically get your place on year 1. You don't have to go through UCAS again. You don't have to apply again. You don't have to be interviewed again, because you will be interviewed for the foundation routes. Whereas if you study an access course somewhere else, there's 2 things that can happen. Well, one, it might not be accepted by the University of Liverpool. We only recognise certain access courses that have the right level and standard of topics that we need for you to be successful with us. The second thing is that if you do an access course, you have to apply through UCAS again and be in competition with all the direct entry A-level students again to try and get into the University of Liverpool. So it's an amazing program in that respect, in that it's considered also for funding with Student Finance England and Wales, I believe, as a 1+ route. So many of our students who have applied through Student Finance England find that this £5,140 can be added to their student finance agreements. Whereas if you go and buy an access course somewhere, usually you have to pay for it unless you're eligible through other means. The bit in red here is quite important. Before all of this COVID situation that we're dealing with, the government had agreed to put in place some money in the form of new NHS government bursaries from year 1 of the degree programme for some of the routes that I've shown you through this foundation programme, certainly the allied health and nursing routes. That non-repayable bursary ranged from £4,000 to £6,000 a year to help students, especially mature students who are switching career, sort of live and finance themselves through their full-time studies. Now, because of the current situation, I'm not quite sure what's going to happen with this bursary. Everything else is taken over, and we're still waiting for confirmation that this is still in place. But hopefully, when we get through the other side of the COVID situation, we will still have this money in place to help our mature students. And is it worth it? Well, yes, it is. And there's a link in there that you can go and have a look at, which is a link for adult learners at the University of Liverpool that features some of our foundation year students in medicine and physiotherapy. So hopefully you'll be able to go and have a look at that. But there's other reasons why it's worth it. This is Matt. Many of our students do give us sort of quotes like this and are happy to promote the programme, because for them, if they hadn't come onto the programme, they wouldn't be where they are today. And as you can see, Matt here is on the physiotherapy route, and he actually is an ex-serviceman and was in the army, and decided that he needed to, once he left the army, he had to form another career for himself. And he's now in his third year in physiotherapy, and will be graduating next summer with a bit of luck. And here we go is Anthony, who's on the medicine route. Again, he had gone off into a different career before finding our programme at the University of Liverpool, and really didn't believe, his self-esteem and his self-belief was really low. I didn't believe he could actually become a doctor, but has found us, has progressed, and he's in year 3 of his medicine degree, so he's got a couple of more years to go before he progresses. There are other reasons why I can say this program is definitely worth it. It's not just about encouraging people to change direction and go into a different route. It's about making sure we keep people on the program and they complete their degrees successfully. And as you can see here, we've got some stats that we can share with you. So 64% of our allied health and nursing students achieve either a first class or a 2-1 degree, and 77% of those that move from our foundation into our undergraduate degrees graduate. Now, some of them don't quite make it, some of them step off with exit awards at different points, and we're looking at reasons why that happens. But that is still an extremely high percentage that are successful on that programme. For the medicine, dents and vet students, 74% are successful and achieve their degree and move on into those areas to practice. So as you can see, overall, we've got a really high percentage of healthcare professionals, whether it's in looking after humans or looking after animals, that progress through the programme and contribute to the healthcare system in our country, which is really, really encouraging. If you've got any questions, here are my details. There's my email address and my office number. There's some pictures here of graduation with some of our foundation students on. And this is a picture of the place in Liverpool where we hold our graduation ceremony, which is really quite a wonderful day, a really, really amazing day for our students that get through to the end of the programme. Okay, so I'm going to look through and see what questions there are, if there are any. Let's have a look. I can't see any here. All right. Okay, what I'm going to say is that to get onto the programme, you only need 5 GCSEs. For medicine, dentistry and veterinary science, you need 5 GCSEs at grade B or above. And for the allied health and nursing, you have to have 5 GCSEs at grade C or 5 in numerical terms now or above. In those 5 GCSEs, you have to have maths, English and a science to be able to apply. As I've said before, it's full time. So you can work, sometimes you can work part time while you're on the program. But we have to kind of emphasize that it's quite full on because you have to do all these topics in 12 months. So we would work with you to find time within the week when you can actually carry on with your part-time work. If you need that to keep going, we can do that for you. I'm just seeing if anybody else has got any questions about the program. So we've got, trying to see who's actually in the session at the moment. We've got Madison, Emmanuel. We've now got Rachel here in the session as well. No, don't seem to be any questions as of yet. Okay. I'm trying to think of all the questions that I'm normally asked at open day to see if I can help with those. I think what I would say is that, there is one more stat that I've not given you. The percentage of students that progress from the foundation program into their direct entry year one routes is very, very high. It's over 90%. So we are really, really pleased with that stat, because that means that we're doing our job properly and we're helping our students to progress into year one of their chosen career. Okie dokie. Still doesn't seem to be any questions popping up on the feed. So what else can I tell you about the program? About oh yeah, there is other things that happen on the program, as well as studying out at the two colleges and studying those A-level type topics. We also offer what we call taster sessions. So 4 days in the year, you'll come into the University of Liverpool and you will be taken into a teaching session on your program routes that you've chosen into your professional route, and you'll be able to sit in a class, you'll be able to take part in a class so that you can find out what it's like to study in higher education. So it helps the transition and integration of our foundation students into a higher education environment. For some students on different routes, you'll be invited into something called HARC. That's HARC. That's our Human Anatomy Resource Centre, where you will watch other students looking at what we call prosections, so real human bodies and parts of bodies, to study their anatomy. So these are cadavers, we call them, that have been donated to the university for research and for teaching purposes. So some of you may see that. Other students will be invited into the imaging departments, where you'll be able to see what it's like to take an X-ray, for example, or to image a patient using a CT units, because we have both of those in the university. We also have an MRI unit at the university as well, so for diagnostic radiography and radiotherapy, you can visit those. For nursing, we have a full clinical suite with, it's like a mini ward, so people can get a feel of what it's like to actually be on a real ward before they go out into clinical practice. The other thing about our clinical programs, once you get onto year one, is that we believe it's important to get our students out into the clinical environment as soon as possible, so that they can experience authentic, real life learning on the job, so to speak, but obviously under supervision. So for all the programs, we do that very, very quickly. We get our students out, certainly in year one. And you might want to hear that through this pandemic with COVID, although we had to withdraw all our students originally, we were quite proud really that many of our students asked if they could go back into clinical. And so after lots of screening and lots of training, our students went back in. So we were very proud of them. Okay.
Thank you for the wonderful talk. You have touched on so many points to know, not only as a student, but also for anyone interested in health careers. We're so excited. We were so excited to have you today, and thank you for your time, and thank you for the very, very interesting talk.
Oh, it's all right. You're very, very welcome. Happy to take emails after the session.
Thank you so much.